Let's see. Bear with me. Okay. Tell you what, if when I call on you, you answer me quickly, I'll just ask one question. If it takes me a long time to get a hold of you, then I know it's going to take a long time next time, and I'll ask you like 5 questions. So that way we'll see if we can move a little bit quicker. Can you guys see where it says Muscular Anatomy Boot Camp Mixing It Up? Miss Mejia, who suggested that, wanted to make sure that we had homework tonight, also suggested we mix up the, no, I'm kidding. She did, but we would have done this either way. Don't blame her for everything. This is Tapscott's fault. Okay. All right. And I'm just teasing Miss Mejia, I'm sorry. Okay. Let's go. Miss Trotter, you're in 2 places on my screen. How is that possible? That's amazing. Good for you. Okay. Yeah. 2 scoops of Trotter. I love that. Well, Miss Trotter, if you're going to be that bold, then you are the first person I'm calling on, of course, but you are responding quickly, so just tell me what that is.
That's the rectus femoris.
Thank you very much, ma'am. I love that. Beautiful. Sorry, hold on. Miss Routson. What's this muscle, ma'am? Miss Routson? Are you there?
Can you hear me now?
Yes, I can hear you now. I can hear people in your background. I just couldn't hear you.
Looks like the supraspinatus.
There we go. That's better. Let's try one more, ma'am. Abductors, abductors, muscles that might abduct your body would live on which side of your body? In the middle, on the outside, in the front, in the back?
You want me to name all of them?
No, I want you to tell me where I might find muscles that do abduction. You don't even have to have abduction in the name. But muscles that would cause abductions of my shoulders or hips, for example, would be located on the anterior body, the posterior body, the lateral body, or the medial body.
Probably the medial, abductors pull away, so I'm going to say the lateral side
Beautiful.
of the body.
Not only was that beautiful and correct, your intellect and the way you put it together was correct. You're absolutely right. To pull on the outside, I've got to be on the outside. Thank you. Good job. Cool, cool. You're done. Good. Okay. Mr. Tate.
Yes.
What's this muscle, sir?
This is the brachialis, or
You're close.
Coracoid process, or the
Put it all together.
it was something with a C, but it's the brachialis.
You've actually said the answer in 2 different parts. You just need to put it together.
Is it the core brachialis?
Pretty close. Yeah, coracobrachialis. But you are right. It goes from the coracoid process to the brachial region. Coracobrachialis. Good job. Thank you, sir. Miss Suriel. Miss Suriel?
Yes, Mr. Tapscott.
Oh, Miss Suriel, what muscle group is this?
That is the longissimus longissimus. Is that, am I right?
It's a whole muscle group, though. What's the whole group?
Yeah.
The longissimus is part of this group. You're right, the longissimus is in that picture.
I can't remember the group. I remember the name of the muscles.
So, what does the longissimus do?
Oh, it's the erector spinae group.
I love it.
God, I'm sorry.
Don't be sorry. I love it when you guys think.
Yeah.
That makes me very happy. Thank you. Thank you, ma'am. Miss Allure. Dear Miss Allure.
Hello.
Miss Allure, I say Terry's minor. You say what?
Latissimus dorsi?
Latissimus dorsi is the largest muscle in the upper body.
Infraspinatus.
There you go. You tell me another
Sorry.
small muscle. Infraspinatus. Okay. Thank you, ma'am. Cool. Miss Sarno, what muscle is this?
Rhomboid major, rhomboid minor.
Yes, both rhomboids. Thank you, ma'am. Mr. Riedel.
Yes.
I say latissimus dorsi. You say what, sir?
Teres major.
Yes, sir. Thank you, sir. It's been a pleasure. Mr. Placencia,
Yes.
what is this muscle?
Levator scapula.
Good. What's its action?
It elevates the scapula.
Yes. Do you know its origin and insertion? Even roughly?
No.
Okay. Well, you can see its insertion.
Yes.
Cool. So describe it. Try to.
It is it's on the medial side.
Medial border of the scapula.
Superior angle.
Yeah, that's totally legit. Your book would it'd say the medial border of the scapula between the spine of the scapula and the superior angle. But yeah, I just wanted that kind of thing. So the medial border of the scapula by the superior angle, cool. And then it inserts into the side of the neck, into the transverse processes 1, 2, 3, and 4. Cool. Good job. Thank you, sir. That was above and beyond. We're digging to find out the limits of your knowledge. Yeah. Miss Munoz. Oh, can't keep going that direction. Miss Munoz.
Yes.
Miss Munoz, I say infraspinatus. You say what?
Teres minor?
Yeah! You sounded terrified like you weren't sure, but you were right. Teres minor. Yes, ma'am. Thank you very much.
Okay.
Miss Mejia,
Yes.
what muscle is that?
Trapezius.
That's true. What are the actions of the trapezius?
Which fibers?
You tell me. Like,
So-
all of them. Like, I want to know them all.
Okay, so the upper fibers of the trapezius elevate the scapula.
Yep.
I think they do something else.
Well, we could probably argue that they help with like lateral flexions and stuff like that. And extend the neck, by the way.
Yeah.
Cool. And tell me about the middle and lower fibers.
The middle fibers, they adduct the scapula.
Yes.
And the lower fibers depress the scapula because they're antagonists of the upper fibers.
Yes. So a little cocktail party kind of, question is, what muscle can argue with itself? And actually, the trapezius can. There are other ones, but trapezius could actually be an antagonist to itself because the upper fibers could fight the lower fibers. Well done. Thank you, ma'am. Miss Marez.
Is that the PEX major?
Ma'am, it is the PEX major. Well done. Thank you, Miss Marez. Miss Lobitz.
Yes.
I don't like the way I wrote this question, and I don't like the way I've written it. So if you have a hard time with it, it's probably me. But where would adductors live? What side of the body would they live? And I don't even mean ones with a name, but ones that can do that action.
Medial?
Yeah, they've got to be somewhere in the middle to pull things back to the middle. That's why the question was there. You nailed it. Thank you. Thank you for rectifying my poor test question. Miss Carodi.
Hey,
Hi, Miss Carodi. Miss Carodi, what muscle is this?
rectus femoris. Rectus femoris.
Rectus femoris is how you say that muscle, but, Miss Carodi,
Oh.
this muscle does not cross over the hip and does not insert up into the anterior inferior iliac spine, so this is not the rectus femoris.
Right, so it's the rectus and major
The what? Are you making up muscles over there?
Minutes.
What? This is very hard what we're doing now.
What's in medial? No. Medialis? Rectus medialis. Sorry.
It's okay.
Right.
It is a vastus. But look at that leg. It's not on the medial side.
Intermediate.
Yes. Yes, it's rectus intermedius. Yes, it's underneath the rectus femoris. It's right in the, yeah. Good job. Thank you. Thank you, thank you. Miss Hawks.
Hi,
Hi, Miss Hawks. Miss Hawks, what's this muscle?
that's the teres minor.
That is the teres minor. You make it look easy, Miss Hawks. Thank you. Miss Estes.
Yes.
I say teres major. You say what?
Latissimus dorsi.
Yeah. You're absolutely right. Thank you. Cool, cool, cool. Mr. Brown. Mr. Brown.
Hey, Mr. T.
Mr. Brown, what muscle is it? What muscle group is this?
Is that a pec, the arm?
Did you say is that a pec, the arm?
No.
It's
I'm
a
trying
leg.
to find it.
It's a
A
leg.
leg?
It is the posterior side of the femur.
It's a weird looking leg. Oh, okay, I see. That's the hamstrings.
Yes, it is, sir. Thank you. It is the hamstrings. Mr. Blygen, what muscle is this?
We're looking at the vastus lateralis
Yes,
and
thank
the
you,
IT
sir.
band.
And he's absolutely right, by the way. Vastus lateralis with the IT band going over the top of it. Well said, sir. Thank you. Miss Jong.
Hi.
Hi. I know this will be hard because these are out of order, so don't worry. Do you know what muscle this is? June, you need to help too. Do you know what muscle this is in red? It's on the medial femoral compartment. It's on the middle thigh.
Is it longest? Adductor.
It is an adductor, yes. Adductor.
Adductor. Magnus.
Yes, she's right. Adductor magnus.
Magnus.
Adductor magnus.
Magnus.
Good job. Thank you, ma'am.
Thank you.
Miss Walker, why?
Hello.
Hello, ma'am. What muscle is this?
Adductor. Actually, no, just kidding. That's gracilis.
Gracilis, yeah. Good job. Which is an adductor, but that's beautiful. Thank you. Okay. Miss Walker T, what muscle is this? Down here.
You said T, right?
Yes, I did.
Calling me. Okay, what muscle? This is the vastus medialis.
It is the vastus medialis. Thank you, ma'am. Miss Vincent.
Yes.
What muscle is this?
Pectineus.
It is the pectineus. That's good. I think that one's really hard. Thank you.
You're welcome.
Miss Miss Routson. Miss Routson. Miss Routson.
I'm here. There's a delay because I have to switch my Bluetooth to phone for you to hear me.
It's okay. What muscle is this?
So, of course, you asked me the one I don't know instead of pectineus. That is.
Or what band
Shoot,
of fascia is
I
this?
want to say. I don't know. Help me.
Well, there's a big fascial band there on the side of the leg. What do we call the big fascial band going down the side of the leg? It goes from the crest of your ilium to your tibia.
The IT band?
Yes, which stands for iliotibial band. So that's a lot of fascia. So what could tense up a lot of fascia? What muscle could tense up a lot of fascia?
Is it the tensor fasciolate?
What a good name for a muscle that could tense up a lot of fascia. Yep, on the IT band. Beautiful. Thank you.
Yay, thank you.
So cute. Miss Trotter, we're back to you. Are you ready? Okay, that's what they all say. What is this? It's a rotator cuff muscle, or a hamstring, or a calf.
Damn.
That was mean, I'm sorry.
Transverse abdominis?
Yes, how did you know that?
Because it's wrapping around like the ribs.
Yes, because the fibers go transversely across. Beautiful, thank you, well done. Beautiful, beautiful, beautiful. Mr. Tate!
Mr. Dotska.
What's this structure in red?
Structure is the sciatic nerve.
Thank you, sir, you nailed it, thank you.
So, thank you.
Ms. Suriel!
Yes, Mr. Toptop.
Ms. Suriel, what's this muscle?
That's the pectineus?
That's an excellent guess. If you were wrong with that guess, what would your second guess be?
Oh my God, it's also, I remember the name, but right now I just can't. Is there any hint?
Sure. Well, what muscle group is this in?
My God. The hamstring. That's the hamstring.
Well, hamstrings are on the
No,
back of your leg.
No. The
This is,
hamstrings are in the back.
yeah, this is the medial side of your leg.
Yeah, I just forgot.
These are the muscles. These are the muscles that pull your legs back together. They kind of add them to the midline.
Oh, the adductor?
Ooh. So this is an adductor, which is why your guess for pectineus was excellent. Pectineus is about in this place and about this size. But this isn't pectineus.
Yeah, I can't remember.
That's
I'm
okay.
Sorry.
Don't be sorry. Do you mind? Can you name me the 5 adductors?
Adductors brevis, adductors brevis,
Well, magnus. Yeah, longus,
Longus?
brevis, magnus. Yeah, cool.
longus brevis. Then the other two is the pectineus, but that's the other one that I cannot remember.
Gracilis.
Gracilis.
Yeah.
Okay.
So which one is this?
That's the gracilis.
Well, gracilis is the one that goes all the way across the knee.
So then is that the adductor medius?
There is no adductor.
Medialis.
There's an
Oh my
adductor,
God.
brevis, longus, or magnus. Does this look short, long, or huge?
That's brevis.
Yes. Good job, ma'am. Thank you for hanging in there with me.
Thank
Good
you.
job. Miss Allure?
Yes.
What muscle is this, ma'am?
Iliacus.
You are right. Iliacus, thank you, ma'am.
Mm-hmm.
Miss Sarno. This is a hard question, Miss Sarno. But muscles that can help you flex, muscles that can help you do a flexion, would I usually find those muscles on the posterior side of my body, the back of my body, the anterior side of my body, the front of my body, the lateral, the outside of my body, or in the middle of my body? Where would I find things that help me do a flexion?
On the back.
Well, show me a flexion of your neck. Oh, now I understand the problem. That was an extension.
Oh, extension flexion.
Yes. So if this is flexion, where would I find muscles that do flexions?
The neck.
Yes, in front though. In front.
In the front.
In the front of your body, or the front of your arms, front of your legs, all those muscles would help you, well, not all of them, but help you do a flexion. Yeah.
Gotcha.
I don't mean they're named flexors, but they help you do a flexion. Most muscles, if you look at me really quick here, hold on.
Bicep brachii.
Biceps brachii is a flexor. Yeah, it helps you do a flexion of the elbow. Brachialis is a flexor, helps you do a flexion. Rectus abdominis helps me do a flexion. All this happens in front of me. Yes, good job. That's what I meant.
And what is it? Inside the hip, they get from
The
spine.
hip flexors, yes.
Yes.
And that would be tensor fascia lata, gluteus minimus, rectus femoris, iliopsoas. There's a lot of stuff. Yeah, but that's what I meant. You got it. Thank you. That's really good. Cool. All right. Mr. Riedel. I think you might have gotten this question before, Mr. Riedel. Mr. Riedel.
Serratus anterior?
Yes, it is. Thank you, sir. Mr. Placencia.
That's the psoas major.
Yes, sir, it is. Thank you. Miss Munoz. What muscle is this, Miss Munoz?
That is the longissimus.
Well, you're in the right muscle group. Where does the longissimus go all the way up to?
Oh, no, that's not. The longissimus goes down and up to the occipital up there.
Yeah, up to the mastoid process. Yeah, good.
That is the, wait, longissimus. Oh my gosh. Well, I have them in order. Is that the iliocostalis?
What does iliocostalis mean?
That they're attached to the ribs?
Oh,
no, that's
No, stop. You're right. I just wanted you to know why you're right. The costalis means ribs. You're absolutely right. And ilial means the crest of your ilium. So that's your hips and your ribs. And look what this muscle does. Yeah, it goes, you're absolutely right. It goes from your hips to your ribs. Good job. Thank you, ma'am. Really well done. Miss Mejia, what's this?
The longissimus.
Yeah, where does it insert?
Into the mastoid process.
Yeah, of the temporal bone. I love that. What are its actions bilaterally and unilaterally?
Hold on. So you're talking about the erectors.
Sure, all of them. Yeah, basically.
They help with extensions of the spine.
Yep. That's bilaterally. What do they do unilaterally?
Unilaterally, they do lateral flexion.
Yeah, lateral flexions. Good job. Thank you, thank you. Nicely done. Miss Mares. Miss Mares, what is this muscle? It's really it's one muscle, but it's a half up here and different half down here. They should have put both together, but.
Spinalis.
Yes, it is. It's attached to the spinous processes of the vertebrae, and it's the spinalis, and you nailed it. Thank you. Let's see. You don't get that one, Miss Lobitz. I'm sorry. You get this one, Miss Lobitz. Miss Lobitz, what is this muscle?
Rectus abdominis.
Yeah, and what action does it create?
I don't know.
I don't know.
I guess it could be flexion since it's on front, but it mostly just.
No, by the way, you nailed it. It flexes something. It is a flexion. It's in front and it causes you to, yeah, so we'd call it a flexion of the spine.
Okay.
Yeah, kind of crunch down there and my back has to bend and do that. That was really good. I love the way you went through it logically. That was really good. Thank you. Miss Carodi, what's this?
Sorry, didn't hear that.
That's okay.
It's pec minor.
It is pec minor. Good job. Thank you, thank you, thank you. Miss Hawks, what are these two muscles?
Those are the multifidi and the rotatories.
I like multifidi. Multifidi, or I'm not making fun of you, by the way. No, multifidi might be right. But anyway, multifidi, multifidi, I don't know. Anyway, and rotatories, you're exactly right. Thank you. Good job. Good, good, good. Miss Estes. Ooh. Ooh, this one's a toughie. We've had some problems with this one, Miss Estes.
We have.
Separates the women from the girls, the men from the boys, you know?
I'm going to say semisplenus capitis.
Semispinalis capitis. So it goes up part of the spine and goes to the head, and you are right. Good job. I love that. Okay. Mr. Brown, what is this muscle group? Mr. Brown?
That's the muscle group that the occipitals.
Does the what occipitals?
That's where the occipital ridge is, yes?
Yes, you're right. That is the occipital region, and those muscles are found in the occipital region, kind of under the occipital region, which is why we call them the under the occipital region muscles. So what do we call them?
I'm gonna take a stab because I don't know.
Occipitals is correct, sir. I want you to put a word in front of occipitals.
The inferior occipitals?
You are wrong, but you are wrong for all the right reasons. Suboccipital. Thank you, sir.
Suboccipitals.
Like, I love that answer. I'm going to start calling these the inferior occipitals. That was good, sir. Really was. I'm serious. Your logic was excellent. Thank you. I'd rather you understand the language than memorize the stuff. Mr. Blygen, you don't get that. Mr. Blygen, what action is performed in this picture?
So that's going to be supination.
I hope you're right. Supination, sir. Yes, sir. Thank you. Miss Zhong, what muscle group is this? It's a group, whole group.
Spinal.
Well, the spinalis is in this group. But what's the group called? The entire. Yes.
Spinal.
That was really good. Erector.
Erector.
That was good.
Yes.
Erector.
Erector.
Spinalis.
Erector.
Yeah, or erector spinae, but erector spinalis works too. Erector spinae. Sorry, I didn't want to throw you off there.
Erector.
Spinae. Good. That was good. Thank you, ma'am.
Thank you.
Miss Walker. Why? It's very amazing what you're doing, by the way. Miss Walker, why is this? What action? These are tricky. And I put them on here for a reason, because at the end of the year, you get asked some of these questions and people get very confused because the person's elbow is bending. But the person's elbow is only bending to help show the movement. The movement is not happening at the elbow, it's happening at the shoulder. What movement is this person doing? We've never shown this slide before, we've never asked this question before. So if you don't know, it's okay.
Lateral something. Or is
a lateral.
It's not abduction, right?
No, but I love what you're saying. Lateral. What has to happen? What?
No.
What?
Lateral rotation?
That's exactly it.
Okay.
So guys, in the picture, it doesn't look very good just to rotate back and forth like this. So they stick a hand out so that you can see which way the arm is rotating. But the movement is happening up here. My elbow's not moving. My arm is rotating up here. And so if it goes out, this is a lateral rotation of the glenohumeral joint. Cool. I love it. Good job. Or some people call it an external rotation too. I love that. Thank you. Thank you. Thank you. Miss Walker T.
Yeah.
Miss Walker T, what is this muscle?
Quadratus lumborum.
Excellent. What are its attachments? And I'm only asking that because I feel like you can see them in the picture and you could tell me.
Transverse processes.
Yes, the transverse processes of what?
Like the L's.
Yeah, by the way, guys, she's pretty darn accurate. It's transverse processes L1, 2, 3, and 4. It doesn't get to 5 down here because 5 is so low it's almost hitting your head. So transverse processes of L1 through L4. And then what's this down here, or up here, I should say?
It's a rib on T12.
Yes, it is the 12th rib, your last final floating rib. And what's this little crest here?
The iliacus crest.
Yeah, so it's the posterior iliac crest gets in back. Good job. But by the way, guys, what I'm starting to do is just try to get you used to how you can visualize something in your mind, and then you can actually label the attachments and stuff. So anyway, good job. Really good. Thank you. Which brings us to Miss Vincent, and we will take a break here soon, everybody. Miss Vincent, what muscle is this?
Internal obliques.
Yeah, that was good. Internal obliques, because if I put my hands inside here, that's how these fibers would be going. They're kind of going backwards. Yeah, I love it. Internal obliques, nicely done. Really nicely done. Miss Routson. What muscle is this?
Is that the sternocleidomastoid?
It goes from the sternum to the clavicle to the mastoid process. Yeah, thank you, ma'am. What's the nickname for it?
Prayer muscle.
Prayer muscle. Thank you. Let's see, Miss Trotter. Miss Trotter, what's that?
That's the bicep brachii.
Yeah.
Right? No?
I understand why you said that, and I understand why I said yes, so we both got it wrong. But this lies underneath the biceps brachii. This does not have two heads. It's so similar, it'll drive you nuts.
Brachialis?
Yes, ma'am. It's the brachialis. You did really good. What action does the brachialis perform?
Flexion.
Of the elbow.
Yes.
Of the humeral ulnar joint. Yep. All day long, that's all it can do is that. Something else has to actually get it to go back out. But it just does that all day long. Stop. Nope. Keeps doing it. Yep. Cool. Awesome. Thank you. Thank you. Mr. Tate. Oh my gosh. This is horrible. Sir. Anyway. Sir, what muscles insert into the mastoid process of the temporal bone? We know of 3 now. One is on your back side, it's really long. One is on your front side, it helps you be holy. And the other one attaches your spine to your head or your cap.
Right. So we're talking about, which one, are you asking for one or all 3?
All 3. There's actually
All 3?
4, but we
Okay.
haven't learned the 4th one yet.
All right. So the one in the front would be the I'm sorry. I'm driving, so I'm still driving. So the one in the front is has the clavicle, and that is called.
Goes from the sternum.
The sternum, right?
To the clavicle. To the mastoid process.
The mastoid.
So it's called. It's okay.
The sternal collido.
Yeah.
Okay, that's what I thought. I couldn't figure out the middle part. I just started to see.
So sternocleidal what?
Sternocleidal. I want to say no. Is it mastoid?
Yeah, sternocleidal mastoid. So that is one
Okay,
muscle
that's what I
that
said.
definitely right here.
Sorry.
SCM definitely goes in the mastoid process. Cool.
Okay. Right. The next one.
Yeah.
Okay. Is it the capitis? The capitis spina.
Yep. So switch those.
Okay. The spinous capitis.
Splenius capitis. Yeah, it comes out from the
Splenius
spine
capitis.
and goes out to the sides and hooks in there. Good. Splenius
Yeah.
capitis, and there's another one in back that's really long. What's it called?
Is it called the subsplenius capitis?
No, it's. I feel like
Super.
it's. I feel like it's gonna have something to do with the length of this muscle.
Oh, okay. Is it long?
It
is
is
the longest capitis, or no?
Do we have a spinal rector that goes all the way up to the mastoid process?
Yes, we do.
Cool. What's its name?
Spinalis? Right? The one that goes all the way up?
Yeah, but do we have...
No, it's the longissimus.
Oh, the longissimus! Yes, sir. That was it, sir.
Okay.
Good job. Longissimus.
Oh.
Thank you.
Sorry.
Don't be sorry.
I'm driving.
That's why we're doing this. It's fun.
Okay, cool.
You're not, we're only halfway through. We're good. This is good. Thank you.
Yo.
Miss Suriel.
Okay.
All right, so this guy is just lifting his arm up like this. What's he doing?
He is hold on.
I will.
He is flexing.
He is doing a flexion of
shoulder.
Yes. So give me the technical name for the shoulder. That's hard. You there? You might have said it, but we didn't hear you. He is flexing his shoulder.
Yeah.
The shoulder. What's the name for the shoulder?
I don't know.
It's where the humerus meets the glenoid fossa of the scapula.
Oh, it's a human.
Switch it.
The scapulohumeral joint.
I love that. Yeah, glenohumeral joint.
Glenohumeral joint. Thank you.
Thank you, ma'am. Good job.
I'm sorry today. A little.
Yeah, you're good. That was good. Thank you. All right. Let's see. Miss Allure. What's this person doing?
Is it a medial rotation?
It is a medial rotation of what joint?
The glenohumeral joint?
Yes, ma'am. Good job. That's just bent down here to show you movement, but the movement's coming up here. This is where I'm turning. Going in is a medial or internal rotation of the glenohumeral joint. Really nicely done. Thank you, thank you, thank you. I love it. Miss Sarno. What muscle is this?
Deltoid muscle.
Deltoid muscle. Thank you, ma'am. Mr. Riedel. Oh, that's...
yes.
Mr. Riedel. Extensors. Muscles that would help you. They don't have to have the word extension in them. Don't worry about that. But muscles that would help me do an extension. Would they be found on the anterior side of my body, the posterior side of my body, the lateral side of my body, or the medial side of my body?
Posterior?
Yes, he's right, everybody. Because usually, not always, but usually I'm extending backwards. Usually it's happening, and to go backwards, I need to be pulled backwards. Those muscles would have to be on the back side of me, the posterior side. You're exactly correct. Thank you, sir. Well done. Really well done. Mr. Placencia, what muscle is this?
Latissimus dorsi.
Excellent. What 3 actions can it create?
It can. It can adduct the arms.
Yes.
It can. That's the only one I can think off the top of my head.
What do you call this?
That is extension of the shoulder.
Yeah, so I know, like, they're getting nitpicky with us, but really this muscle brings your arm back down to your body, right? It helps you do a pull-up or whatever. So I can do a pull-up while I'm adducting. I can also do a pull-up when I'm extending. But both are bringing my arm down in front. Does that make sense?
Mm-hmm.
Cool. And there's one last thing. It can actually help with a rotation because of the way it inserts into your arm.
Oh, because it inserts into the front, so it can rotate it internally.
Yes! Can create a medial rotation because it actually comes underneath here and can actually turn my arm in medially. Well done. Thank you, sir. Really good. Ms. Munoz, what is this action?
These pictures are horrible. So it's out. Pronation?
Yes, ma'am. If I was holding a bowl of soup there, I'd be prone to dump it out. Really nicely done. Really good. These are like deep cuts, and you guys are doing good. Pronation. Nailed it. Miss Mejia.
Yes.
Miss Mejia. It's going to come as a shock to you, but I'm going to ask you what muscle this is. You seem to be stalling for time. I can see right through it because I'm a teacher.
No, that's the external. They're not the obliques, unless they are, but I don't. They're external. I don't know. External guys on abs.
Well, you decided it's an ab, or have we even decided that yet?
Well, yeah, they're abdominal.
Oh,
muscles.
okay. So, what are the name of the 5 abdominal muscles?
No.
Miss Mejia, you gotta focus. Focus.
The rectus abdominis, the transverse abdominis. They are obliques, aren't they? The internal and external obliques, and then the quadratus lumborum.
Okay. So, can you narrow it down to which abdominals it might be?
I think they're either internal or external obliques.
Good. Okay. So, we got diagonal muscles on the side of your body, around your tummy. Oblique means diagonal. Abdominal means tummy. So yeah, you're in the right area. So it's probably an internal or an external oblique. And what did Tapscott teach you to do with your hands?
This, and then that. So it's the external obliques because they're on top. Yeah.
Cool.
There we go. I had it. Why didn't you just let me have it early?
I'm sorry. I'm not done yet, ma'am. I want to ask you also.
No. Okay.
If they work unilaterally, what type of rotation do they create?
If it's just one side, what rotation is that? What you're asking me?
Yeah. Well, let me be more specific. Will it rotate to the same side as the muscle operating, or the opposite side? Will your torso rotate to the side that's being contracted, or to the opposite side?
So if it's just doing one side, I think it will go to the side of the muscle. So it will do lateral rotation.
Yeah, I mean, you can't really talk about your torso just rotates, right?
Yeah.
Yeah, but let's say this guy's oblique. This is his left external oblique.
Mm-hmm.
If that contracts right now, which way is his upper body going to turn?
That gets shorter. Will we go to the left side?
So think about it. I've got a muscle from my rib here going down, and if I pull down, what's going to happen?
Oh, I was thinking that pulled the other way.
Yeah. You can actually use your arms to figure out these questions if it ever helps. You can actually reach that external arm thing I was doing. You can actually reach down with one of your arms and kind of figure that it would pull you to the opposite side.
Oh.
Does that help?
Okay.
Yeah.
Yeah.
Good. Cool. You're good. We're gold.
Okay.
It's good. We got obliques. We're good. Yeah. I was just trying to up it a little bit for you. Just keep you on your game, all that good stuff. Good. Thank you, Miss Mejia. Let's take a break. It's 4:30. And yeah, all that good stuff. All right, everybody? Let's take a break. 4:35 till 4:50. I'll see you guys back at 4:50. Okay? Doing good. Major?
Yeah.
Yeah, she's exactly right. I mean, we could get nitpicky about other stuff, but that's the low-hanging fruit correct answer. Thank you very much, ma'am. That was really good. Thank you. Miss Hawks.
Hello.
Hello, ma'am. Miss Hawks, what are the 5 adductor muscles? Hip adductor muscles?
Adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis.
Great. How many of those cross over the knee joint? They all cross over the hip joint, but how many cross over the knee joint?
Would it be the gracilis?
Yes.
So 1.
Perfect. I was kind of pausing to kind of mess you up, but you did great. Yes, the gracilis, and that's it. The do you remember that weird name where the gracilis inserts? It's okay if you don't. We haven't talked about it much.
Really, no.
Okay. It's a name. Anybody know this one? Where does the gracilis insert? Miss Estes,
Is this
you
the
raised
one about the spinach?
Oh, never mind, Miss Estes. What, sir?
Is this the one about the spinach?
The pes anserinus.
Yeah, the pes anserinus is correct. What is that? Spinach?
You told us the story
That
about
was
how you
that was
remembered something.
asparagus. That was Linea aspera.
Yeah. Okay, yeah, that one.
They're all greens to you. Yeah, it's called the pes anserinus. And what does the pes anserinus mean? Anybody? Miss Estes, please, take it away. You got this one.
It's a goose foot.
Yes. So what happens is 3 muscles come down and insert in the same place their tendons do, and it looks like a goose's foot. It's on the medial side of your proximal tibia, and it's a little sensitive there. And the pes anserinus, the gracilis inserts there. Miss Estes, do you know what other 2 muscles insert there? Gracilis. There's one from an adductor. That's gracilis. There's one of the hamstrings inserts there.
One of the semis.
One of the semis, good. And why did you guess semi? Is it because you knew they're on the medial side and this thing's on the medial side? Good.
Yeah.
Good.
Maybe the tendinosus. Is it the?
It is the tendinosis.
Is it? Okay.
So semi-tendinosis. And then the other one is a lone wolf. It's not in a group.
Sartorius?
Yes. All 3 of those insert. And later we're going to find out they kind of triangulate the inside of the knee and keep it stable. That was well done. Thank you. Oh, everybody, that was well done. And it was kind of your turn, Miss Estes, so that was perfect. Perfect timing. Yeah, I like when you chime in like that. Mr. Brown.
Yes, Mr. C.
What 3 muscles insert into the pes anserinus to form the pes anserinus, sir?
Pes, I'm assuming the pectineus.
No.
You said the pes anserinus. That's where the adductors are, right?
Yeah, it kind of is, sir. Like it's on the medial tibia, and one of your adductors inserts there. Do you know which one? It's the one that crosses over the knee.
The brevis.
So brevis would be too short to get down to the knee.
Because brevis means small.
Because brevis
I'm
means
trying
short.
to think of the Latin. You said they had like different words in Latin. I'm trying to think of the one.
Yeah.
Magnus would be the biggest one.
So I asked you this question, sir, because I just asked Miss Estes this. So I'm going to review for you, though. So hold on. Miss Estes, don't disappear on me. Really quickly. What 3 muscles... Sorry.
No, you're good. You're good.
She's taking a shower by now. She's like...
Yeah, right.
Well, I mean, I understand. If somebody had just called on me, I'd be like, I've now got 15 minutes. Like, I can do something. I'm going to brush my teeth. Anyway, what are the 3 muscles that form the pes anserinus, Miss Estes?
The gracilis.
Gracilis. That was the adductor. Good.
The semitendinosus.
Semitendinosus from the hamstrings. Beautiful. And the lone wolf.
And the lone wolf is the sartorius.
Thank you. All right, Mr. Brown, what are the 3 muscles that insert into the medial proximal shaft of the tibia at a location called the pes anserinus?
The gracilis, the sartorius, and the... I forgot the last one she just said.
It's a hamstring muscle.
Semitendinosus.
You got it, sir. Good job. Thank you, sir. Thank you. Mr. Blygen. Mr. Blygen. Let's do this, sir. Mr. Blygen, what action am I performing here?
You're pantomiming. Let's go with. Okay, no, then that would be something else then. Okay, so do it again. Breaststroke. Okay.
I mean, at some point that action is going to become another action. What action am I performing there that's happening in front of my body at my glenohumeral joint, sir?
That's flexion of the shoulder.
Yes, good. All right, but that actually wasn't the hard part of the question, although maybe it was. What muscles did I use to do that? This is hard. We have never done this before, but we will start doing it.
Hold on. Let me do something.
Yeah.
So you are using the muscles of the biceps brachii?
Yeah, I actually didn't think about that one off the top of my head, but he is right. Biceps cross over. They can help in a shoulder flexion. Excellent answer, and one of the more difficult ones to come up with. Give me some more.
Okay. Hold on. Flexion.
That is, by the way, that is a weak flexor of the shoulder, but it does help. You're absolutely right. You got some stronger ones.
So, pec something? Pec major?
Yeah, pec major is actually legitimate. What fibers?
Okay, so also the deltoids, the
Which fibers?
anterior
Yes.
fibers of the deltoid.
So everybody, like anterior fibers of the deltoid is the main muscle that lifts your arm up like this. Excellent. It's beautiful that you got biceps brachii because they can do this too. You're absolutely right. And you said pectoralis major, and you are right. But which fiber is the pectoralis major?
Upper.
And if you want some help, I'm going to take myself up here. Because your pectoralis major does something kind of weird, remember? It kind of crosses over at the shoulder. This is ridiculously exaggerated, but it's for purposes of helping you figure out which fibers. These are my upper fibers, these are my lower fibers, and they cross over each other as they go over the arm. So which ones do you think would help me do a flexion, sir?
I'm going to say the upper.
You were going to say, and you're right. The uppers would actually pull me into a flexion. The lowers actually help me with a pull-up, believe it or not. They actually pulled down my arm some. That was really good. Cool.
Hey, while you're all taped up there.
Shoot.
Yeah.
All right.
So, I don't know why, I feel like I know the answer to this, but I just haven't looked at it in a while. The pec major in the minor, so the major fibers run the way that you have it taped.
Yeah.
And then the minor goes down at an angle.
And the major hooks to the humerus and the minor hooks to the scapula, they're almost, I mean, they're related in the sense that they often work together to perform certain tasks, but not certain, they're very different muscles. One is pulling on the scapula and one is pulling on the humerus.
Yeah, I was just more concerned the way the fibers run. So
yep, like this.
The minor runs that way, and then the major runs upward at an angle.
Well, the major runs two ways in a way.
Do you have a skeleton so I can see that, or something with a pec on there?
I don't have a skeleton with a pec.
Or a muscle.
Yeah, probably. Probably. Yeah. Hold on, buddy. I don't know how well you're gonna be able to see it, but we'll find out. Here we go. So, here's the fibers of the pec minor coming down off the coracoid process. Here's the fibers of the pectoralis major. These bottom ones kind of run up here. The top ones run down here, and they actually cross right here. It's hard to see on a person. It's easier when I tape it off. So actually, these lower fibers kind of act like the pec minor, kind of. Does that help at all? Sir?
Yes, it did.
Oh, it did, okay. Cool. So, is there any other muscle that could help with a flexion of my glenohumeral joint. Any other muscle that might attach to my...
So the teres, the one that... No, the teres are in the back. My bad. Hold on.
I was thinking maybe a muscle that attached to the medial side of my middle humerus and came from some other place. Kind of looked like this a little bit.
Oh, the coracobrachialis?
Yeah, coracobrachialis probably helps you with the flexion and horizontal adductions. Good job, sir. Super hard question. But it won't be hard by the time you graduate, so that's good. Awesome. All right, let's finish up a few slides, guys, then I'll leave you time for homework. The homework that I assigned yesterday, not new homework. Yeah? Cool. Good. We approve. Okay. I like it when we approve. Let me finish with this. When we last left, I think we left off with Miss Mejia. So, Miss Mares, what muscle is this, Miss Mares?
That's the infraspinatus.
You are you're wrong, but you are in the right area. So think of other muscles by there. But you are right, that is the right area for infraspinatus.
Is that the...
This muscle does not go with infraspinatus.
It's the major.
It's
no, the minor or the major?
If it doesn't go with infraspinatus, which one is it?
The major. I'm sorry. The major.
Yeah, why are you sorry? That was great. So it's what major? What's the word in front of it?
The teres major.
Nice job. Good job. Thank you, ma'am. Miss Lobitz, what are these two muscles? You can leave the dog. It's okay. We'll figure it out.
Teres major and teres minor.
Good. Which one's on top?
Minor.
Thank you. So I feel like, Miss Carodi? Dear Miss Carodi, I've got an awful question for you. Miss Carodi? Oh, there you are. Sorry. I didn't see you, so I thought you could. Can you see me? Miss Carodi? Unmute. Talk to me. Miss Carodi.
Okay, I'm here.
Okay. Miss Carodi, what
I'm here.
muscles attach to the medial border of the scapula? Hold on. So, if we've got a scapula here from somebody's back, this is the medial border. There are 4 muscles that attach to this border. Do you know what they are? This is a hard question, ma'am.
What's scapula?
Yes, I'm here. I'm listening.
Yeah.
Yeah, the short massage that we do.
There's
The short massage that we do.
there's sorry, that's
It's okay.
So you're laying in a prone position, and they still do work on the neck shoulder back.
So,
And it's the same
can you show one more time, please?
Yes, of course you can, my dear. It'd be back like here.
Uh-huh.
So it'd be muscles kind of back in here.
Trapezius?
Trapezius does attach to the scapula, but not here. But that was a really good answer because you're in the right area.
Okay.
So, I don't know if this helps. But so, these muscles would be back in here,
Yeah.
underneath the trapezius.
Underneath the trapezius is
Like
rhomboid major.
Yes! Rhomboid's major, rhomboid's minor.
And
And then if you go up higher, what's this one that comes off here and goes into the neck, kind of like?
it's right there. So that's
La.
anterior pigeon.
Levator. 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 Eula. Good. So we got. This is for everybody too, by the way. Everybody, we got rhomboids major, rhomboids minor, levator scapula, and then hook to the same border, but in front, coming from here. Not the subscapularis. That's actually attached in here. This thing's right here. In front is the serratus anterior. So rhomboids major, rhomboids minor, levator scapula, and then the serratus anterior. Yeah? Sorry, that was tough. Don't worry. It's okay. Your brain's a little fried. It's all right.
Yeah, the tiny crazy.
Yeah, we're getting there. It's all right.
No, don't do it.
So let's keep it PG here, people. I don't know what's going on over there, man. You guys are crazy. Okay.
Yeah, he's saying sorry.
Don't be sorry. It's awesome.
Okay.
Okay, I'm cutting you off though. You're done. But I love you. Miss Hawks, what muscle is this?
That's the infraspinatus.
Infraspinatus. I love it. Let's see. You are right. Thank you, ma'am. Miss Estes. What's this action, Miss Estes?
That is a lateral rotation.
So, yes, that's not what they mean though, but you would actually be right. I don't like they put a curve in that because it makes it look like it's rotating. They just mean the arm going back though.
Oh, going back
Yeah.
is extension.
Yeah. But by the way, like I wouldn't even call that a mistake. I agree. The way they drew it, it looks like a lateral rotation, but they mean extension. It's very weird they curve that thing. Anyway,
Yeah.
very, very good job. That's good. Mr. Brown, what is this muscle? We're just about done. Well, 20 more to go.
That's the, I know that one. That's the splenius capitis.
Dude! Nice job. Yes, that's the splenius capitis. Thank you, sir. Mr. Blygen.
Yes.
What's the muscle in red?
No, it's the teres. I feel like you give me this one every time. That's the teres major.
So, what's the muscle above it?
The infraspinatus.
Okay. And if they weren't colored differently, would those two muscles look the same?
Oh, teres minor. Yeah, they would.
Yeah, good job, sir. This is good. It means I still have work to do. I've got job security. You guys don't know everything yet. That's good. You're making me very happy. Your pain is my joy. Thank you. Awesome. Awesome. Let's go back. Mr. Brown, what is this?
That is the pec. No, the pec minor and major over my forearm.
Keep thinking. You're doing good. I love the mistakes you guys are making because you're making mistakes in the correct region of the body. You know what I mean? You're not listing off stuff that doesn't belong there. There is a pec major and minor around there. That is not them, but you're right.
It's not the serous because the serous is the chainsaw.
It is a muscle that actually attaches here and then goes into the humerus, but it attaches on the fossa underneath the scapula here.
Oh, supra would be over here, infra.
Submarine? Sub what?
Subscapularis?
Yeah, it's the subscapularis. I don't like this picture, everybody, but it does make a really important point that if you want to access the subscapularis, which oftentimes you do with shoulder problems, you've got to do it from the front here. This is how you have to get to it. That's why that's why I keep the picture around, so to speak. All right. Ooh, Miss Estes. The trapezius. Oh, I like that micro expression, which was I don't know. The trapezius shares attachments exactly with what other muscle?
The deltoid.
Yeah. What are those three attachments?
Clavicle.
Mm-hmm. The whole clavicle?
Just the lateral third or whatever, right?
The lateral 1/3 of the clavicle. Yes, you're exactly right. That's right. Nice.
The acromion process, right? And then the spine of the scapula.
Yeah. And everybody, I don't mean to run this in the ground, but those sound like three hard things. But in real life, the spine of the scapula turns into the acromion process. And the acromion process would, right here, bump into the clavicle. Good. Awesome. Thank you. Well done. Well done. Ms. Hawks, I have no idea why the pectoralis major is here. Never mind. Ms. Hawks, what is this?
That's the biceps brachii.
You are right. Thank you, ma'am. Oh. All right, Miss Carodi, I'm sorry. It's twice in one day. One last question. The serratus anterior can argue with, it can act as an antagonist to what muscle? Serratus anterior pulls your scapula forward and down. This muscle pulls your scapula back and up. This muscle protracts and depresses the scapula. The muscle I'm looking for actually retracts and elevates the scapula. This muscle, the serratus anterior, is kind of found in front. This muscle is found in back. It was one of the muscles I just quizzed you about, too.
Yes.
I don't understand what you said. What's the opposite of this muscle?
Interior?
Pec minor is a friend of the serratus anterior. It is a synergist. They work together. These two muscles, really, but we call them by one name, do the opposite of the pec minor, opposite of serratus anterior. They're in back and they pull the other way. So the serratus, and I'm making a big deal out of this because this is where shoulder tension often comes from. Serratus anterior is pulling my shoulders down like this. These muscles pull it back.
Is rhomboid major?
Yes! Rhomboid's major and minor. Good. They don't necessarily fight, but they do the opposite of the serratus anterior. Good job. Very hard questions. Very good. Hang in there. Miss Lobitz, what muscle is this?
Triceps brachii.
Yeah, why can I not see one of the heads?
It's deep to the other two heads.
Yeah, it's beneath the other two heads. Cool. Awesome. Thank you, ma'am. Miss Marez, the deltoid shares attachments with the, there's a method to my madness. Yes, shares an attachment with what muscle?
Would it be
So the origin of the deltoid shares the insertion of another muscle or attachments with another muscle.
would it be the clavicle? Or the scapula?
Well, actually, okay, you're almost making it more tricky. So you are right that the deltoid attaches to the clavicle and two parts of the scapula. What other muscle attaches to those same parts of the clavicle, those same parts of the scapula?
The humerus.
No, sorry. You're thinking bones again. So the deltoid comes up and actually inserts into the spine of the scapula, the acromion process, and the clavicle. That's kind of the deltoid. Let me help here. Hold on. So this is not a very good picture, but so the deltoid hooks on up here. Does something else come down and hook onto this same spot and meet the deltoid here? What's this muscle up here?
I'm not sure.
Think about it for a second, because I think you got it. What would this muscle be up here? I'm not doing a very good job. I'll give you another example. What? Don't overthink it. If I tell you, you're going to be mad.
Oh, I'm sorry. It's a trapezius.
Yeah! Cool. Don't be sorry. It was awesome. I love it. Thank you, ma'am. Miss Mejia? What muscle is that?
Yes.
What muscle is that?
I think they're trying to show the brachialis.
They are. It is deep to the what?
The biceps brachii.
Yes, awesome. Awesome, awesome, awesome. Just about done. Cool. Miss Munoz. The serratus anterior, Miss Munoz, is a synergist. It works with, it's buddies with another muscle that does the same thing. The serratus anterior protracts and depresses, or abducts and depresses, and this muscle does the same thing, so they often work together.
Pec minor?
Yeah! Bam! Nice, really nice, thank you. And this is significant, people, because when we have shoulder problems with people where they're tightened back, we want to be working their pec minor and their serratus anterior in front. That's why I keep hammering this. These are kind of typical massage solutions to body problems. Awesome. Let's see, where was I? Oh, Mr. Placencia, what muscle is this?
Splenius capitis.
Splenius capitis. It is one of the muscles that inserts into what process?
The mastoid process.
Yes, along with two other muscles that insert in the mastoid process.
Sternocleidomastoid and longissimus.
Thank you very much. And later, by the way, we'll learn a superhyoid called the digastric that also inserts back there for those of you that like to overachieve. All right. Thank you. Boom. Let's see. Mr. Riedel, what is this darker muscle in red? Mr. Riedel? Don't leave me now. If you leave me now. Going once, Mr. Riedel. Going twice. Gone. All right. Where was I? Miss Sarno. Miss Sarno, what muscle is that?
Adductor longus.
Yeah, the minute you said adductor, I was already happy. Adductor longus. Strangely, it's not the longest one, but that's it. You're absolutely right. So, adductor longus. Good job. Thank you. And that's it. Okay.